Welcome to Health Matters, brought to you by the Office of Correctional Medicine at Southern Illinois University School of Medicine. This video is for informational and educational purposes only. It is not intended as medical advice and should not replace consultation with a qualified healthcare professional. Always seek the guidance of your doctor or other licensed medical provider regarding any questions you may have about your health or medical condition.
Hi, I'm Liz. Today I will show you the proper technique for using an insulin pen. An insulin pen looks like a pen. A few examples of insulin that comes in pens are Lantus, Novolog, and Humalog. The insulin pen has a cap, a rubber stopper, a cartridge scale, a cartridge, a dose indicator window, a pointer, a dose selector, and a button. To prepare for the injection, you will need the insulin pen, a needle, and 2 alcohol swabs. Always use a new needle with every injection. Ensure that needles are neither reused nor shared. Before the injection, the pen can either be stored at room temperature or in the refrigerator. Generally, pens can be used for 28 days if they are stored at room temperature. If stored at room temperature, the pen should be labeled with a beyond use date. The stability at room temperature can be found on the back of the insulin pen box. If the insulin pen is stored in the refrigerator, you can either let it warm to room temperature prior to the injection, which takes around 15 minutes, or it can be used while it is still cool. The injection will sting more though. Next, make sure you have the correct insulin for the patient. Check the name of the insulin and the expiration date or beyond use date. Then, wash your hands with soap and water and don gloves. Take the cap off of the pen. Make sure the insulin is clear and free from particles. Wipe the rubber stopper with an alcohol swab. Attach the needle. Make sure the needle is threaded on the pen straight. It's important to prime the insulin pen before each injection to remove any air bubbles and to ensure the pen is working properly. To prime the pen, dial the dose to 2 units. If you go beyond 2 units, you can go back. Point the pen vertically with the needle at the top. Tap the insulin cartridge to release any air bubbles. Press the button. The dose selector should go to 0. You should see a drop of insulin on the needle tip. If you don't see a drop of insulin, repeat those steps again. If you are still having problems, replace the needle and prime the pen again. After proper priming, check to make sure the dose selector is at 0. Dial the dose to the correct number. When you dial the dose, the pointer will line up with the number in the dose indicator window. Do not press the button while you are dialing the dose or insulin will come out. Dial will not go past the units of insulin left in the pen. If the dose is more than what is left in the pen, you can either use the remainder in your pen, then use a new pen to make up the difference, or you can discard the current pen and take the entire dose from the new pen. If the dose is over 80 units, the patient will have to administer 2 doses. Once the pen is dialed to the correct dose, hand it to the patient. You can inject either in the abdomen, the thigh, or the back of the arm. If the patient chooses the back of the arm, make sure the needle tip is no longer than 4 to 5 millimeters in length. Educate the patient to rotate injection sites. It may be necessary to look at the medication administration record and tell the patient where the previous injection site was. Each injection site should be separated by the width of an index finger. Document the injection site and dose, if necessary, on the medication administration record. After the injection, ensure the needle is removed from the pen and disposed of properly. Never store a pen with the needle attached. Recap the insulin pen and store it either in the fridge or at room temperature. Be sure to change gloves between each patient.